So, good afternoon, everyone, or good morning, or whatever your timeline is. One of our constant reminders is to keep moving, keep moving, keep moving, whether you have Parkinson's disease or not. And this is Things to Know Right Now. It's about movement. I'm Jo Rosen, president of Parkinson's Resource Organization, and I have the pride and joy today of introducing you to someone I've known for a long time. Her name is Renee Gauthier, and she is the owner of Innergy Therapy, which is headquartered in Azusa, California. And my sincere hope right now is that the fires and the smoke are not affecting you so much. We've got the virus, now we've got the fires, and everybody is up in the air. But we all need to keep moving. And so we'll talk a little bit about that today. You're a registered physical therapist, Renee. And you have your master's in public health. Tell us a little bit about you, and welcome and thanks for being here.
Well, good to have be on here, Jo. I've spoken at a few of your support group meetings in Glendora, which is always nice to see Parkinson's people getting out and their caregivers. So I've been a therapist for, don't really want to say, a long time.
Okay.
I've had my own practice for about 20 years. And that has afforded me that the patient, client, and I decide what we want to do because I don't take insurance. So we get to be the bosses of what we do, what they think they need, what I think they need, and we can move forward and keep them moving.
Well, and so you're a unique physical therapist, and we'll get into that as we go through today's. But so one of the things that we always tell people with Parkinson's is to move, 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 because it is the best medicine in the Parkinson's world is exercise, and it can even help such the major complication it appears in Parkinson's is constipation. And when we move and when we exercise, we can even help with constipation. So what do you think is the difference between exercise and physical therapy? So, I mean, not what do you think, but could you tell us what that difference is?
So in my mind, the difference is you have something that the person can do on their own on a regular basis. So in my mind, physical therapy is to help, give challenges to all kinds of things that that person can't do on their own, whether it's improving their flexibility or their posture or their balance. Also, moving them in a direction for strengthening that is good for them, not overtaxing for a Parkinson's person. And being able to monitor, when things aren't going well, to change it up, that, okay, we're missing something has changed in their body. We need to, change things up to focus on that so they don't ultimately have that go away, because it will if you don't push it forward and make it work.
So, for instance, if someone was having more difficulty shuffling, or their movement was much slower, or they can't get in and out of the car very easily, or they can't get out of bed or roll over in bed, these are all issues that we hear about, and that's something the physical therapist works on, right?
Yes, absolutely.
And do you kind of train them then on things that they can do?
Yes, absolutely. Sure. There's breaking down the movement, seeing where they are having difficulty, and whether it's a flexibility problem, a strength problem, and then addressing it in the manner that helps them work through that. I will say I've seen the big program
Yes.
Do a good job of improving people's, flexibility, balance, strength. And that's great. I don't do that program. I do refer people to that program in my area. But again, they need to keep up their work.
Yes.
And, at times, need a tune-up.
Exactly. Now, it's what makes you unique, as I said earlier on, is that you employ some different modalities into your physical therapy practice that not too many other physical therapists include. And as a matter of fact, right now you're the only one I know who does aromatherapy in your practice, and you also do reflexology in your practice. Let's start with aromatherapy. Give us an idea of what does that mean to our listeners and how do you employ it?
Aromatherapy is the use of essential oils in a clinical therapeutic manner. So all my oils are pure, whole, not synthesized, and they're blended in a manner for that particular individual.
Oh, so you do the blending yourself?
I do.
Wow. Okay.
So, Parkinson's people run into regular problems as well. Their skin is dry, they get a cold, they have a wound or a blister or, any number of things along that
Their
line.
muscles are sore.
And if they want to use a more natural way of dealing with that problem, aromatherapy is a great problem solver that way.
It's a wonderful augmentation. I mean, personally, I have a massage therapist, and she uses aromatherapy, and I must tell you, I understand the benefits of it. I'm hoping that our audience, if they have not ever had aromatherapy, as they're going through physical therapy or massage, it's something to talk about with your therapist and see if you can be educated on the benefits of it. Again, it's more of a holistic approach to something, but but the value is tremendous as far as I'm concerned.
And I really love the essential oils for their boost to the immune system.
Yes, yes, exactly. So that's, and how do you employ that when you're doing physical therapy exactly?
Well, usually it's kind of a separate conversation. There's various modes to have it get into their body. And we talk about what they would like to do. And usually it's something that I blend for them, and then they use it, the conditions that I prescribe for them.
Okay, like when
Sometimes
you get out of the shower or when you're getting
right,
into
right.
bed
It
or
depends
before
on
you
what the
go to bed.
condition is. Yeah.
Yeah, okay, terrific. Now, the other modality that you include is reflexology. And so tell us a little bit about that and why you include that.
So I do foot reflexology. There's also for the eye and the ear, and the hand, but I don't do that. Um, but I believe, for Parkinson's especially, what their feet do on the floor is really, really important for keeping moving. Um,
And balance.
right, right. So there's just all those little spots on the feet that are to be
It's kind of like a map, isn't it?
right,
Are
right.
feet
The
the bottom
rest of your body is mapped on the bottom of your feet, well, ankles too. Um, but I've found some really useful things that somebody's having a little problem with constipation or some other issues, and reflexology, massaging those spots is really helpful, and they get the benefit of having feet that will move better than they did before because we've loosened the tissues up, and they're not having foot pain, which you know,
Is that
it
another
helps
place?
walking.
Is that another place where you use your aromatherapy? Is in the reflex?
We can,
Yeah.
sure.
All right. I find this fascinating because whether you have Parkinson's or any other issue, I think physical therapy is obviously critical for many, many, many people. They don't even understand that with the use of having a physical therapist, they may get better movements and more amplitude, if you will, with
Hmm.
from your. And then with the aromatherapy and the reflexology, both of them being very therapeutic and relaxation oriented, it's just, I can't imagine someone not using that. I mean, I keep saying over and over and over when people say, oh, it's not covered by insurance, or, oh, but I have to pay for this. The answer is, what price is good health? I mean, if that's what we're looking for is good health, maybe we give up a Starbucks or maybe we give up something else for a while in order to get what we would call quality of life and quality of life treatment. I am just so I think I've said to you this to you before, and I know I have, but we get such nice testimonials from people that you've worked on, and we know one person in particular that we think he actually thinks that the reason he's had Parkinson's for 20 plus odd years and is still doing so well is because of you and the work that you've given him over all these years. So it has, it carries its own weight as to the benefits of it.
Yeah.
Thank you for doing that. Is there anything you'd like to specifically add or say to our audience today that I haven't covered or that we haven't covered together?
Um, so since I do go to people's homes when, you know, and definitely Parkinson's is one of those that I go to people's homes with, just because sometimes getting out is hard for care person or the Parkinson's person. I think it's really good for the therapist to see, especially Parkinson's, in their own home setting and what's going on, and can problem solve things that are happening that they may be having difficulty with. And rather than, kind of throwing in the towel and saying, oh, I'm not going to do that anymore. Or, I'm not going to go into that room, even though that was their favorite place, or, something's there that they enjoyed, that we can problem solve. Uh, whether it be some kind of adaptive thing that we do, or work on something with that person, show the care person how to help them, and be able to, as you said, continue with a quality of life that is makes them happy.
Yeah, so there are two words that you use that make me think that we should add two things to our conversation today. One, you go to their home. Now we've got COVID-19 going on and we have restrictions up at the zoo. What are you doing anything special going to their homes?
Special in terms of, I wear a double masking, just like most caregiver or healthcare people do. Um, Depending on the Parkinson's person, um, and what we're doing, I may ask that they wear one too. Um, and disinfecting, cleaning everything down, washing hands, taking their temperature. Um, so,
Yeah, so you have
really, other than that, treatment per se is what they need. And, I haven't run into a situation where I wanted to do so-and-so treatment, but I said, nah.
yeah.
So,
Well, and I think most people with Parkinson's are pretty quarantined, so they've stayed in. So as
right.
much as you have to worry about yourself and they about you, it's understanding that you're vigilant. All parties are vigilant on making sure that they stay as safe and careful as they can. But the other word that you brought up is their caregiver or their
Mhm.
partner in care. So because you go to the home, do you help the caregivers other than by helping the ill person? helping them a lot. But do you also add to doing something for
Well,
them?
having conversations, care person might be having some issues, with pain themselves, can make suggestions. I do treat a few caregivers, you know, after I treat their person they're caring for. I have done quite a bit of aromatherapy for the care person because, they want to calm down a little bit, or
Yeah, yeah.
um, just, they have some problems of their own, and we can help with that. So,
So and so this is something that you can do. So the uniqueness of your work is important for our audience to know. Our audience also needs to know that you primarily work in the Los Angeles kind of area. Glendora is, I don't know if you call that a suburb, but it's a part of the LA area. I
mhm,
know that you've also gone to Orange County, and
mhm.
so I know that you're willing to drive, but I think our audience needs to know that you are available in LA and Orange County if the drive is not too far, and that you can come to their house and treat not only the person with Parkinson's in a therapeutic fashion, but you can also help the caregiver or the partner in care with issues of his or her own. If they
Mhm.
throw their back out because they're lifting or moving or turning the person with
Right.
Parkinson's, or they've thrown their hip out, or maybe their shoulder got misused because of what they were doing with the person they're caring for. I think it's such a wonderful attribute that you have, that you bring with you in going to someone's home. So, to our audience today, I just want to say to you that if you need a physical therapist in your household, and if you can afford to do this without an insurance backing, if you will, then you really need to get a hold of Renee Gauthier, and you can find her in the Wellness Village on our website. So she has been there for quite a few years already, and she is still there. And we love promoting her because of the quality of life and the goodness that she brings to people with Parkinson's and their care partners or partners in care. Renee, I can't thank you enough for speaking with me today, for taking your time today. And again, I do want you to be careful. I know the fires are right around your corner, and I feel so bad when I think about, and I watch the news from the Los Angeles area, and I see the devastation. Just keep safe and do what you can to take care of yourself.
Well, thank you very much, Joe. And you stay safe as well.
Will do. Thank you again. And to our audience, the Wellness Village is your first shot to look at to check out Renee. And she will be a presenter in our village meetings. So pay attention to the calendar and the invitations that we send out to the village meetings, and watch when she presents, because it'll be on a different issue than what we've talked about today. It'll include other issues, and you'll have an opportunity to ask questions. So again, Renee, thank you so much. For everybody, have a great day, and we'll see you soon.
All right, Joe.